Why do transverse myelitis symptoms start so quickly? Have you ever wondered why transverse myelitis symptoms can appear so suddenly? This condition involves acute inflammation of the spinal cord, which is a key part of our nervous system. When inflammation occurs, it disrupts the normal function of nerve fibers and their protective myelin sheath. This disruption leads to a rapid onset of neurological symptoms, including muscle weakness, sensory changes, pain, and issues with bladder or bowel control. The quick appearance of symptoms is mainly due to how our immune system reacts. When triggered by infections, autoimmune responses, or other factors, the immune system sends inflammatory cells and signaling proteins to the spinal cord. These agents cause swelling and damage to the myelin and nerve cells, which impairs the transmission of nerve signals almost immediately. Since the spinal cord is crucial for communication between the brain and the rest of the body, even small areas of inflammation can lead to significant symptoms below the affected area. Most individuals with transverse myelitis notice their symptoms progressing within hours to a couple of days. In fact, many reach their most severe state within just 24 to 48 hours. This rapid progression is quite different from other neurological conditions like multiple sclerosis, where symptoms may develop more gradually or fluctuate over time. The swift onset in transverse myelitis reflects the acute and localized nature of spinal cord inflammation, which can abruptly disrupt motor, sensory, and autonomic pathways. When we look at multiple sclerosis, which is a chronic condition that can also affect the spinal cord, we see some similarities but also key differences. Multiple sclerosis symptoms typically evolve more slowly and can remit and relapse, while transverse myelitis usually presents as a single event with rapid symptom emergence. However, it is important to note that transverse myelitis can sometimes be the first sign of multiple sclerosis or be misdiagnosed as such, since both conditions involve immune-mediated damage to myelin. In summary, the reason transverse myelitis symptoms start so quickly is due to the acute inflammatory process in the spinal cord that rapidly impairs nerve function. This leads to sudden and severe neurological deficits. The quick onset is what sets transverse myelitis apart from other demyelinating conditions like multiple sclerosis, even though they share some underlying immune mechanisms. If you or someone you know is experiencing these symptoms, it is crucial to seek prompt medical evaluation and treatment to manage inflammation and reduce the risk of long-term damage.